Hey everyone, today with us we have Dr. Pankaj sir, who is the President of Indian Society of Digital Dentistry and the Founder Director of Smile Pro Dental Care. We welcome you to our program, Adela sir. So my first question is, what made you develop interest in digital dentistry?
Um, since being in practice since last 23 years, probably last 15 years, I've been visiting the biggest dental show, that is IDS in Germany. And probably around 8 years back, I had visited IDS in Cologne, and that's where we saw that digital dentistry is making its inroads in dentistry. I saw a lot of scanners, I saw a lot of milling machines, though it was very expensive at that time, but it just opened my eyes. And probably this happens after every 2 years. So next 2 years when I went back, that time I was pretty much decided that this is a branch of dentistry which I want to go in. So probably yes, visiting conferences and visiting such big trade shows opened my eyes towards digital dentistry.
So you have a specialized practice focused on advanced dental implantology. Can you briefly tell us about it?
Advanced dental implantology is actually a culmination of three branches. One is the surgical acumen. Again, the next is the diagnostic phase, and the third one is the digital planning. So these three things, when they come together, so with this you are very much sure when you are planning. So for that, say, in terms of technology, what all we involve. In terms of surgical, we do the latest technology like PET, then we do PRF. These are bone grafting solutions. Then in terms of diagnostic phases, we try and do all types of intraoral scanning and CBCT planning. And with the help of digital implantology, we make the surgical guides, because that's the focus of our practice. So with the help of all these three planning phases, we can be assured towards better results, far more accuracy, and the best part is patient satisfaction.
So since when have you been inculcating this into your clinical practice?
Yes, implantology I've been practicing since 2006, but this probably started in 2016. That's where digital dentistry was exposed for me as a practitioner, and yes, slowly accumulating the knowledge in terms of all the three fields, and we shifted our entire practice towards this advanced implantology.
The dental office of yours in Goa primarily caters to dental tourism. Is there any specific reason behind that?
Yes, again, the urge to do something different. Though my practice is basically based in Pune, which is one of the big cities in Maharashtra. But I always wanted to learn more, and to learn more, you have to practice far more better. In that sense, in 2006, that was around 8 to 10 years after I started my practice, we found that there were a lot of tourists coming to Goa, and these tourists, there's a certain class of the tourists, they are all 50 plus. So as you are aware that there is no dental insurance, so in abroad also. So basically most of these tourists who come to Goa are all what we can call it from UK or European countries, and they are all 50 plus, and they are actually looking out for a good dental treatment at a good cost. And I think we as an Indian, we are always known for our skill sets, but it was only about the approach and applicability. So I found this way out where Goa was not very far from Pune. I could visit. So there are times when during the season, that is from November to April, I'm practically every month in Goa. I have an entire team of doctors working with me. And it also helped me to invest a lot, because now I'm not only competing with fellow dental surgeons in India, now I'm actually competing with fellow surgeons from abroad. So we try to give the same kind of a treatment, and India being developing country, we have a cost advantage. So implants, a good quality implants, what they would get at somewhere around 3,500 to 5,000 pounds, we are giving the same company implant with probably same skill sets at a fraction of cost at around 500 to 600 pounds. So it's 1/10. Yes, so it's 1/10. and people are very happy. I've been treating almost today, if you ask me, around 4,000 patients have been treated since last 2006, so it's 14 years. And we are getting very good response, though a very focused and limited response. But yes, we today also this year, after COVID 2 years, we already have our appointments booked for next 3 months after November. So I see that this is in this way, it's for you yourself to grow as a practitioner, and you get a good connect all over world. I have now friends in Finland, Germany, Greece, South Africa. That's where I have connected as a patient-doctor relationship.
So you have grown both professionally and personally. So coming to my next question, what can we expect from the upcoming Digital Dentistry Implantology Conclave?
Yes, this conclave was actually since this was the idea, which along with my friends, few of my colleagues, this was inception done in probably last year, and we thought that this is a branch of dentistry. We as an Indian dental community should be more exposed, because now what was happening was we were going abroad to just learn. But now we thought that we have so many doctors over here who would like to learn these things. Why not get the speakers to India? So from that point of view, we have organized, we have got the best speakers currently. We have got the KOLs of Exocad, KOLs of all the big companies coming down to India. And trust me, it was not very difficult. It was just about requesting them and taking care of their basic necessities. And they are more than available for us to share their knowledge. And again, by this, we ourselves grow in terms of knowledge and sharing our own cases. So what we are doing is we are creating a community who can start sharing their knowledges. Okay, I have done this, what is next? Or somebody will tell, I have done the next thing, but I am falling short in this. So there was no this community, and that's what we are trying to create in India.
That's quite impressive, sir.
Well, that's the idea actually.
So coming to my last question, do you think there will be a day where with minimum intervention from the dentist and with the help of advanced technology, the patient can be treated, like with very minimal intervention?
Sure. I am very much convinced with this. I'll tell you my own experience. When you asked me what got you to digital dentistry, but I will tell you my own experience in terms of the day I went into digital dentistry, my practice actually shooted up 2 to 3 folds. And the reason was simple. The patient went back telling people that here is with very few appointments and I'm getting fantastic results. This actually hit back to me after 6 months when I saw that there is sudden increase in patients for advanced implantology. And when I started sharing this with my friends, they also started experiencing the same thing when they started coming into digital dentistry. One important thing, you asked me about minimal intervention. There is this technology now coming, and he's the clinical director, Dr. Satish from US. He's coming to showcase the robotic dentistry. Now that's the minimalistic, meaning you are actually not troubling patient with the help of, let's say, surgical guide placement and anything. And what I can foresee that the entire full mouth cases can be finished in a matter of an hour with the help of robotic. So what robotic helps you is with the help of artificial intelligence, it actually guides you at a faster rate and with much more accuracy. So I think that's the way out. People are going to be, the fear of dentistry, I think the fear of dentistry is already going. Earlier the way people were scared, today people are more, they're finding dentistry much more attractive because of the glamour of the kind of instruments we have.
And also due to the social media.
Social media, of course, we are also putting, not exactly the cases, but at least the before afters of the patients. And patients are also experiencing, okay, when I can see such gadgets, because dentistry suddenly has become there are a plethora of gadgets which attracts patients. Besides the drills, which were much more, fearful for patient that, oh, he's going to drill. So again, with the help of lasers and all other things, the fear factor from the patient is already going away. So dentistry will be much more enjoyable for patients as well as for doctors.
How long do you think this will take?
No, this is very, very near future. I can assure you this should be in India probably, it's already halfway, but probably in next 3 years time, we will have complete robotic dentistry per se.
That's very soon.
Yes, yes, very soon, very soon. Because the products are already there abroad. It's a matter of time, and you know, when it comes to India, it spreads very fast. That's the advantage of being an Indian and having such a big, huge population, that we have a market here. So we're just waiting the technology to come to India, and probably you never know, there will be some indigenous technology coming from India itself.
Thank you so much, sir, for giving us your valuable interview. It's a huge pleasure for us.
Thank you very much.